Hi, I'm Richanda, and so I'm going to be doing a safe sex series. So whatever stuff about safe sex you want to know, message me. And so the first one of the series is safer oral sex. Okay, so pretty much what is oral sex is one of the main questions. And so oral sex is like an act of sexual intimacy using your mouth. And it can be the mouth to the penis, mouth to vagina, mouth even to anus if you're into that kind of stuff. Kind of weird, but there's like slang terms, obviously, like blowjobs, going down, giving head, rim jobs. Ew. Okay, so lots of people think you can get pregnant from oral sex. I don't know why people think this. That's really weird. But no, you cannot get pregnant from oral sex. But you can get an STI, or lots of people still say STDs, but the proper term is STI now. Okay, so it's up to you if you want to have oral sex or not. I mean, some people like it, some people don't. Like, I'm pretty sure every guy likes it, but like, I guess it kind of depends how comfortable you are in a relationship and where your relationship is at and how your partner feels and yourself, obviously. And you have to talk about STIs. These are caused by viruses, like bacteria and stuff, or like bacteria, in like warm, soft areas, moist, you know, such as your mouth, which you can have like mouth herpes or something, or genital areas, and you guys all know what genital areas are. So pretty much anywhere down there, not just like your penis. Like you can get anus, like not just your vagina, like your vulva and all that stuff too, like anywhere between like the penis and anus, or the vulva and anus even. Although there is less of a chance of getting STIs during oral sex, you can still get them. There's always a risk for that. You can get like bacterial, like, what's it called? Conditions? I mean, infections, that's the word I'm looking for. Like chlamydia, gonorrhea, syphilis, you know, any of those nasty things that you don't want in your mouth, throat, like even that. You can get genital warts even in your mouth. That's disgusting. And herpes is often like transmitted via mouth. And also HIV is a big thing. That could be like transmitted through cuts in the mouth and small abrasions and everything, like just nasty. The only 100% effective way to avoid an STD is to not do anything. But I'm sure like everyone wants to do sexual things eventually. So be safe. If you're planning on having oral sex, know how to make it safer. Like look it up. Okay, and also be safe. Like know your sexual partner's like history and stuff with like any other people, history of like STIs. Just make sure they don't have them. Maybe even get them tested. And protection. So communication is essential. Do not have oral sex if either you or your partner is on any kind of treatment for an STI, or having like outbreak symptoms kind of thing of like, for example, herpes. I don't know, it could be really anything. Any symptoms, go to the doctor right away. If you choose to have oral sex using a barrier method to prevent, I guess, direct contact with the partner's mouth or other partner's genitals, anus, etc., it will reduce your chance of getting STIs. Okay, so as you know, it's easier for guys to have like, they can just put on a condom. Girls, it's harder. I mean, there is girl condoms, but they don't really cover everywhere, obviously. So I have read that you can use some kind of like plastic wrap, like such as saran wrap or like cling wrap. Don't try aluminum foil. It's the wrong kind of wrap. But okay, So the pros is that it's like easy to find in like a grocery store or a drugstore, and it's not that expensive. And it covers like a large area, well, like any kind of contraceptives. It can be used with like oil or water-based lubricants. And you can feel like heat through the wrap still. So the cons are that like obviously you're doing kind of bigger stuff down there. It can rip. So like use caution with fingernails or something. Like I'm sure my fingernails could rip through a condom pretty easily. But but anyone's fingernails could really. So like I guess directions, I'm gonna read off something for this part because I don't have this part memorized. Okay, so you kind of cover the vulva area with plastic wrap, obviously. You can either cut it a piece of the wrap and hold it in place and wrap the pelvic area. To increase sensitivity, you can place a lubricant on the side facing the vulva. Once you are done, throw the plastic wrap away. Obviously, it's disgusting to keep it. If you're rimming, follow the directions above. Place the wrap over the anal area, obviously. I'm going to assume that you guys wouldn't be stupid enough to put the plastic wrap to go on someone's anal on their pelvic area. Okay, there's other things you can actually use in your mouth too, like dental dams. I'm sure you guys have all been to the dentist. Licks, and like latex square barriers. So there are some pros about this. Like obviously it provides like a stronger latex because it's thicker and stuff. And some of them even come in flavors, like the dental dams or glide dams, like vanilla, grape, I don't know what other flavors, but I'm sure there's more if you look, if you don't like those two. So the cons is like it could not be as easy to find as the other stuff, because the other stuff you just go to the grocery store, but this you would have to like look around. Like there's some teen friendly clinics and like such as like Planned Parenthood, and like dentist supply stores carry them, obviously, since they use them in their dentist office. Some feel there's less sensation and warmth with this though. And also it kind of covers a small area, so the fluids may seep past the dam. So you got to use those ones with caution. Watch for part 2, practice safe sex. Thanks for watching. Bye.